Hello and welcome to our video on fibroid embolization, a minimally invasive procedure used to treat uterine fibroids. Fibroids are benign tumors that grow in the uterus and are common in women of reproductive age. They can cause a range of symptoms, including heavy periods, abdominal pain, and frequent urination. If you have fibroids and are looking for treatment options, you may have heard of fibroid embolization. So, what exactly is fibroid embolization? It's a procedure that is performed by an interventional radiologist, a specialist trained in using medical imaging to guide minimally invasive procedures. To begin the procedure, the patient is given a local anesthetic and a sedative to help them relax. The interventional radiologist then makes a small incision in the patient's groin or wrist and inserts a thin catheter, tube, into an artery. Using real-time imaging, the doctor guides the catheter to the uterus and injects small particles into the arteries that supply blood to the fibroids. These particles block the blood flow to the fibroids, which causes them to shrink. The procedure typically takes about 1 to 2 hours, and the patient can go home the same day. Most people experience some discomfort and cramping after the procedure, but this can usually be managed with pain medication. Fibroid embolization is an effective treatment for uterine fibroids, with a success rate of about 80 to 90%. It is less invasive than surgery, and it has a shorter recovery time. However, it is not appropriate for everyone, and it may not be suitable for women who wish to become pregnant in the future. This is because the procedure involves blocking the blood supply to the fibroids, which can cause them to shrink. However, it can also cause scarring and damage to the uterus, which can potentially affect fertility and the ability to carry a pregnancy to term. It's important to discuss all of your treatment options with your healthcare provider to determine the best course of action for you. They can help you weigh the benefits and risks of each option and make an informed decision about your care. Can fibroids grow back after an embolization procedure? It is possible for fibroids to regrow after a fibroid embolization procedure, although this is not common. The success rate for fibroid embolization is around 80 to 90%, which means that the procedure is effective at reducing or eliminating fibroids in the majority of cases. However, it's important to note that fibroids can recur over time, especially if the underlying cause of the fibroids, such as hormonal imbalances or genetics, is not addressed. Therefore, it's important to follow up with your healthcare provider after the procedure and continue to monitor your symptoms. If you do experience the regrowth of fibroids after a fibroid embolization procedure, there are several treatment options that may be considered, including medication, surgery, or repeat embolization. Your healthcare provider can help you determine the best course of action based on your specific situation. Thanks for watching. To learn more about fibroids, be sure to check out our fibroids playlist. Please remember to subscribe for more tips to optimize your health.